widely across the UK.
Okay.
We'll firm up in the details of exactly where the strongest winds will be over the next couple of days.
Thanks, Simon.
This is BBC Radio 5 Live. Available on the BBC Sounds app. 5 Live Breakfast with Nikki Campbell and Rachel Burton.
7:41, families of children with severe epilepsy will lobby politicians in London a bit later over access or lack of access to medicinal cannabis in the UK. They say they are prepared to take legal action over the failure to make the drugs available on the NHS, despite the fact that they were, in theory, legalised in 2018. Dr. Dani Gordon specialises in medicinal cannabis and says nothing much has really happened since the law changed.
Since that time, not a single new NHS prescription has been written. So, this is a big gap.
Not a single one?
Not a single one. There's been private prescriptions written, but of course these cost an enormous amount of money, especially for children with epilepsy who need quite high doses of these medications, despite them being a small body size. So, families are paying in the order of £2,000 a month, bankrupting their families or nearly in many cases. And that's just for the epileptic children, and they are a very important, but actually very small percentage of people who use medicinal cannabis. In Canada, I've treated thousands of patients with medicinal cannabis for a range of symptoms. It's not a cure, but it's a quality of life medication.
What other kind of conditions is it useful for then?
It's very useful for many types of chronic pain, usually refractory to other treatments. Also things like refractory anxiety, even some forms of depression it can be useful for.
Matt Hughes is the father of Charlie, who's 2.5 and whose seizures have reduced while he's been taking a drug derived from cannabis, but he has to rely on getting those through private prescription. Matt, good morning.
Morning.
Tell us about Charlie.
So Charlie was diagnosed with infantile spasms at 10 weeks old, and which is a rare form of epilepsy. And initially he responded well to mainline treatment for 3 months. And then when we weaned off them drugs, it was a very high level of steroid and anti-epileptic, he relapsed. So that was in January 2018. And we've never had control since, since we started using cannabis. So he's tried, 8 different anti-epileptic drugs. He's been on a ketogenic diet. Brain surgery was, we looked at that as an option, but it was ruled out because of where the brain damage is. We started looking at alternative therapies, and the more we researched, the more cropping up about cannabis. So I've spoken with Dr. Dani Gordon, who you've just spoken to, and other doctors as well worldwide. And there just seems to be more and more evidence, anecdotal, observational, looked at different studies. We were lucky that we managed to get a private prescription. Since then, we've never looked back. It's the one drug that's really, really made a difference since the beginning.
How much of a difference?
So it's worse, absolute worst. He was on 4 anti-epileptic drugs, and he was having up to 120 seizures a day. And then they're now reduced down to 20. He has had days seizure-free, but he's now around 10 to 20. It varies day to day. But
120 seizures a day. Yeah. Can you describe for us one of these seizures? Just what's
so
it
his
like?
form of seizures is spasm. So it tends to be infancy. So it's not like a tonic-clonic seizure where you're laying flat on the floor and you're shaking. But so basically he could be sitting up and the whole body goes into spasm. So as a baby, your arms will fold in, your legs will come up. It's almost like being punched in the stomach, and the whole body kind of throws itself forward.
How long does it last for?
It only lasts for seconds, but they come in clusters. He is having clusters up to 40 spasms in one hit. And it's just constant one after the other. It's just constantly dropping. And as he gets older, he can't walk at the moment, but he is, can kind of stand if you help him. But as he gets older, the risks, walking upstairs and things like that, and just having, one of these spasms or a different type of seizure, because there is the possibility with his condition that it changes into a different form of epilepsy. So as his brain develops, as he gets older, the epilepsy can change as well.
Little lad. And at the age of 2.5, at the age of 2.5, he must be more aware now of what's going on. How distressing is it for him? Or is it just part of his kind of normal life?
He's had it all his life. He's 10 weeks old, so he doesn't know any different, bless him. But the detrimental effect of epilepsy at that age is that he's never had the opportunity to learn. So he does have development delay or global development delay. So it means every area of his development, he's way behind. So, doctors are telling us that, he's probably at around between 6 and 12 months in his development. So even though he's 2.5, he's very much like a baby. But he is, since we've started using cannabis, it's not just about seizure control, it's about the quality of life. So he's in his development, he's a lot happier, he's laughing, he interacts a lot more, he's saying mama and dada, he's now starting to say new words as well. So it's all these little, we call them edge stones. It's not milestones, they're little edge stones. They're just little, movements, but his speech and therapy and his portage and his physio, they're all seeing these improvements.
Well, those tiny steps must be joyful for you to see. Now, when we spoke to Dani Gordon earlier, she was explaining that there are a couple of cannabis-related drugs that NICE have approved, but she says they are not kind of whole plant drugs, and they're the ones that are the most beneficial. And she described this process whereby for NICE to approve these newer drugs, they have to go through a very lengthy process of gathering evidence, which can take a decade, is very costly. Big Pharma are not funding this at the moment. Now, she says there is an alternative route to getting approval for some drugs, and they really need, she felt, more research into, what's available, what's around, because at the moment you're paying, a couple of £1,000 a month, something like this, for this prescription?
At the most, to be fair, we were paying initially through an importer. It was around £2,000 a month. We've gone for different importers, UK importers, to bring it into the UK legally, the product that we use from Holland. And we now pay around, it's every month that we have to do, the prescription is every month. So we're paying around £1,300 a month at the moment.
That's a heck of a lot of money.
Yeah,
there are families, presumably, for whom this is not an option.
Yeah, the dose is done on the weight of the child as well. So Charlie's very young, although he's a heavy lad for his age and he's a big lad. If you start getting into teenagers, there's parents that are paying, vast amounts more, thousands more, because their child is heavier, so he needs more medicine. So the costs are astronomical for some. It's crippling for us. We have a mortgage, we have normal lives, we pay our bills, etc. So to have to find the money each month, we have a crowdfunding page, and we sell bits online and just all sorts. Just every month, you're just constantly you're looking after a disabled child, and his needs are first. But at the same time, you're then having to get home from work and then figure out how we're going to pay for this month's prescription, etc. So it's just a constant worry, a constant concern, and at any point you may not have the money that month to pay for the medicine that's helping them.
God, the anxiety that goes alongside that, as well as caring for a child with special needs. Well, I take my hat off to you, I really do, and thank you for talking us through it this morning, Matt.
Okay, thank you.
Matt Hughes, who's the father of Charlie, 2.5 years old, and has this kind of form of epilepsy. A couple of statements to read. The National Institute of Health and Care Excellence, NICE, say they do recognise the need for patients to have access to cannabis-based medicines where they are shown to be effective. They say they need more research. And the Department of Health and Social Care says effectively the same thing. We're working hard with this health system and industry and researchers to improve the evidence for other cannabis-based medicines. 7:49.
This is BBC Radio 5 Live on digital, BBC Sounds, smart speaker and online.
We're going to speak to